Welcome back to San Antonio Living. If you're dealing with chronic pain or even just any kind of lower back pain, we're here to help you this morning. Dr. Brad Nevorowski is here with UC4LIFE, the Stone Oak location, and he's joined by patients Lee and Scott Walton. It's good to see you guys.
Thank you.
Thanks for coming this morning. So you guys are expanding, and normally we have Dr. Torres here. He is busy. There are 3 clinics now operating, and you're at the Stone Oak Clinic.
Correct.
Okay, so it's good to have you here.
Thank you very much.
I know everyone works together at the clinic, but everybody's got sort of a different focus. And you work a lot with people who are dealing with chronic pain. What are some of the causes of that?
We're going to see a lot of structural problems. Obviously, people when they have accidents, injuries, that starts the problem. But chronic pain is going to have several bases, even from like a hormonal component.
Okay.
So people have maybe gastrointestinal problems. They're going to see a root for that. And then just the following, we have inflammation that builds up in the body, and that for joint pain for a lot of times can be an underlying cause.
Okay. So Lee, what was it that brought you and Scott to the clinic?
For me, it was a lot of tension and tightness in my neck. I lost some mobility and being able to turn.
Okay.
My head, a lot of pain, being able to sleep without pain. That was an issue for me.
How about you, Scott?
I'm prior service, and I had injured my back in a helicopter accident, and I had a lot of chronic pain due to that injury.
Right.
And so I was trying to find something that would give me relief from that.
So tell me a little bit about what you're looking for when you're trying to find the root of the problem, because I think that's something that's so important to mention. At UC4LIFE, you guys really do the digging to find out what's causing the pain.
Right. So we try and find out what the underlying problem is, and the pain will actually cause a series of different things. So from a physical standpoint, they may have a pain on, say, the right side of the body. They start to shift the weight off of that to the left side. Now we have pain on that side of the body. It'll cause gastrointestinal problems from sometimes the medications that they take, can cause upset stomach, and just the cascade of things like your cortisol hormone, which is secreted in response to stress. That'll affect things like your blood sugar imbalances. So we see people have problems with that. And then just the whole sequence of going through pain day in and day out. You can also see that we have anxiety and depression come in of having to deal with it if it's not resolved.
It's crazy to me how just a problem with pain can really affect the balance of the whole body. So I know you guys have been on the program, and we talk about 6 weeks to wellness. How are you feeling at this point?
Great.
Yeah?
It's been
You're
amazing.
smiling.
It's been amazing. The changes that I've seen in being able to sleep, my energy level, weight loss, and just my overall mood, and it has improved.
Yeah? Good mood over here?
Oh, fantastic.
And he is even more than me. That's the first thing I noticed about
Well, I spent a large amount of my time having to be very heavily medicated due to all the chronic pain I was experiencing. And I'm almost medication free now.
That's awesome. That is awesome. I know we had a big event this past week, and I spoke to a woman with fibromyalgia who has gotten up and is moving now, and a lot of people don't see results like that. They're surprised by these results. So it's awesome to have you here to talk to you about this. Is this something that you can do with most of the patients that come through the door?
Exactly. What we do is, again, as we learned this weekend, try and find the underlying cause, because sometimes the pain can be the first thing that happens, or it can be something else that drives the pain and sustains it, like things like a poor diet. If we have a lot of sugars in our diet, a lot of the trans fats, a lot of the processed foods that promote acidity and inflammation in the body, that's going to sustain the process going on, so we just never can break that pain. And when they have the right things going in the body, they're eating properly, they're staying hydrated, sleeping well, we're going to see a lot of great changes go on in the body that, it's just going to multiply and multiply, and like they're doing, they're still experiencing good things as long as they stick with the good things that they've learned to do.
It all makes sense. It's all connected, and it's such a unique program, very tailored to each individual. Again, it's UC4LIFE, under construction for life. We do have a special offer for you this morning. You see the phone numbers right there on your screen. We've got a free consultation and a book for the first 20 callers to each of the locations. So whether you're downtown or in Stone Oak or in the city of New Braunfels, call the location closest to you. Mention San Antonio Living. And again, it's UC4LIFE Wellness Center with 3 locations. If you would like to go online, you can. UC4LIFE.com. Again, UC4LIFE.com for more information. Well, don't go away, because up